Health Matters today. It is a disease that is passed to babies during pregnancy, and it is increasing worldwide. And it's something a little bit alarming, too, when I'm going to say it right now. We're talking about congenital syphilis. Dr. Deepika Sankaran with UC Davis Health is joining us live to better understand this disease and why it is happening more and more. Doctor, are you here with us? Oh, it looks like we might have just lost our doctor. We'll try to connect. Oh, there she is right there. Doctor, good morning. Yay, great to see you because this is such a big topic. So talking about this, I just said it. I think a lot of people are wondering, how does an STI like syphilis wind up in a newborn?
So syphilis, even though it's horizontally transmitted among people who are infected with it, it can be vertically transmitted transplacentally when a mother is pregnant and she gets infected with syphilis. Unfortunately, a lot of pregnant women are undiagnosed and they have perinatal syphilis, and they pass it on to their fetus even during pregnancy and during all stages of pregnancy. So that is how babies get infected with syphilis even before they are born.
Terrible. So why do you think this is becoming more widely seen in mothers and their infants right now?
So right now, unfortunately, congenital syphilis is increasing globally, and perinatal syphilis has exponentially increased all over the world. And the main reason for this is mothers not seeking adequate prenatal care and not getting adequate testing during pregnancy for syphilis. And among those mothers who get tested for syphilis, they don't complete the treatment, which is just one dose of intramuscular penicillin injection. So the major barrier at this time causing the increase in perinatal and congenital syphilis is inadequate prenatal care, testing, and treatment of mothers who are infected.
So if a baby is diagnosed with this, what are the next steps for mom and baby, and what kind of complications come with something like this?
So for the mom, like I said, it's just one dose of intramuscular penicillin injection that completely treats the perinatal syphilis infection and prevents the transmission to the newborn. Whereas for the baby, a lot of times the baby can be asymptomatic with no signs and symptoms of congenital syphilis. And if they are not tested and treated, they may have complications such as injury in the brain with CNS central nervous system infection and meningitis. They can have hearing loss and blindness. They can have long-term complications in their bone, whereas all of this can be prevented if the mother is adequately treated. At the same time, if the baby is tested and treated during in the early days after birth, for the first 10 days, they can receive intramuscular penicillin times one dose or a 10-day course of intravenous penicillin. They can prevent these long-term complications. At the same time, there is high risk of stillbirth for these mothers who have perinatal syphilis infection, which is untreated.
Wow. Okay. So basically it comes down to having great prenatal care, right? Better prevention and understanding your body and doing STI testing and doing it frequently, even if you're pregnant. Wow. All right, doctor, thank you so much for joining us this morning. Definitely talking about a serious topic, but one that is necessary. We so appreciate your time. Have a great rest of your morning.
You're welcome. Thank you for this focus.